In the past few years, we've been building capacity in the area of trauma-informed practice in schools with 5 different schools. The idea is for teachers to understand what is going on with the student. The student is not only a student, but a human being that is exposed to adversity in their environment. And so now we are applying the same framework to reach out to social partners and providers, direct service providers, so that they can understand what a client or a consumer or a patient brings into the encounter when they seek services. They are also exposed to adversities in their environment. They are exposed right now, for example, to the layers of stress that the pandemic has brought on them. And so we are building capacity for providers to understand the stressors, the potential trauma that they're bringing into the direct experience, and how can we make that encounter, that service, more sensitive, more responsive to what the client is bringing in. So the idea is for them to, first of all, understand the psychological the concept of psychological trauma. What is trauma? How is it different from a traumatic event? For them to understand the implications of the ACEs study. The ACEs study tells us that what happens in early childhood, all of these traumatic events, really affect people's development, their health outcomes, how healthy they are when they grow up, when they're adults. It affects the way they succeed in education, in their job, in the acquisition of jobs. And so there are many long-term outcomes that come from these early traumatic events.